So, MLS Toby, we click on, we're already live.
Okay.
Okay, yes, we're already live. So, I'll start by introducing you. Thank you so
All right.
much for coming on board. Thanks for honoring our invitation. So, good evening, everyone. My name is Chizaram Ndubeze. I am the program coordinator of Volunteer Medical Laboratory Sciences. Sorry, we are starting behind schedule. That was because we experienced network glitches from different angles. Our our coordinator couldn't join us in this live broadcast because she had network issues too. So, without wasting much of our time, we get into the business of the day. So, I'll start by introducing our facilitator for the day. That's MLS Oluwatobi. So, this is kind of a brief biography of MLS Oluwatobi Adeleye. So, quite early on in life, Oluwatobi Adeleye knew she wanted to contribute significantly to the improvement of the healthcare system in Nigeria. Her quest to do this led to her studying medical laboratory science in the University of Lagos, where she graduated from in 2019 as the best student in hematology and blood transfusion science specialty. Currently, her work revolves around improving the culture of voluntary blood donation among Nigerians through awareness raising, community drives, and education at an NGO called Action on Blood. Together with her colleagues, they have successfully signed up several hundreds of voluntary donors, and they are even geared to do more. A couple of years down the line, she intends to be involved in devising healthcare policies at the national level that improve the healthcare system in Nigeria. Toby is an avid reader, and as a matter of fact, she estimates she has read almost 1,000 books in the course of her life. MLS Toby, that's an impressive bio. Uh, that's beautiful. That's quite brilliant. Yeah, over to you. The floor is yours. Thank you so much.
Okay. Thank you so much for having me. It's good to be here. So briefly, we're just going to go through the topic for today is ensuring safe blood for Africa. And like we all know, blood is usually not a topic that's talked about enough in Africa and Nigeria to be specific. So today we are going to be talking about ensuring that in Africa we have a safe blood supply. Please could you move to the next slide?
Okay.
Okay, so why do we need safe blood? Why exactly should we have safe blood? We need safe blood basically because in Nigeria, every 24 hours, patients in hospitals across Nigeria will need up to 4,000 to 5,000 units of blood for transfusion. So that's quite a large number of people that need blood for transfusion. Also, next slide, please. Also, we have under 5 year children under the age of 5 die in Nigeria from the lack of iron in their blood as a result of malaria. So, for people who are younger than 5, malaria has a more detrimental effect to their health. So, it leads to iron deficiency, and as a result of that, you have so many children under the age of 5 dying as a result of the iron deficiency. Then we have thousands of women dying each year from severe bleeding during childbirth. And this is a very serious thing because we would always have women give birth. We always have people need blood in the hospitals. We always have people have malaria because malaria is endemic in Africa. And yes, in all these things happening, with all these things happening, we don't have enough blood in Africa and in Nigeria to be specific. Our blood banks really are empty. If you go across the country, we do not have enough blood. The blood supply is not being met because of several factors, from the fact that we do not have policies in place, we do not have so many things in place that can make our blood supply safe. So even the blood that is collected in Nigeria, less than 30% of it is what would less than 30% of the blood collected in Nigeria will meet the need of our population. As the last estimate I checked for Nigeria's population says we are about 30%. Less than 30% of the blood that is needed. And the amazing fact is that the blood that is even collected in Nigeria may be infected with HIV, hepatitis, syphilis, hepatitis A and B, and B and C rather, and syphilis. This is due to poor blood collection and screening practices. Now, the solution to this problem, we have the solution to our problem of inadequate blood supply or safe blood in Africa and Nigeria is the first thing that you have to do because is donor recruitment. Donor recruitment is the most important step because without blood donors, there is no blood at all to talk of. There is no blood to talk of, whether safe or unsafe blood. If you don't have blood donors donating blood, we do not have any blood to talk of at all. We, we have to have blood donors before we can start talking about whether the blood is safe or unsafe. So when if we want to have safe blood in Africa, we have to be more intentional about our donor recruitment. The world over knows that it's recommended that the safest form of blood is from voluntary non-remunerated donors. But as it is in Nigeria, our blood supply is not really from voluntary blood donors. The prevalence we have here is either paid donors or family replacement. If you go to government owned hospitals, then we talk more of family replacement donors. But when you go to the private owned establishments, it's paid donors, which is really sad, seeing as the rest of the world is moving on to a strictly voluntary blood donor base. In Nigeria, we are still relying on either paid donors or family replacement donors, and these are not the safest form of blood donors. So the first step is to have safe blood supply in Africa, is to have quality donor recruitment. It's an expensive process, yes, but it's a very rewarding process. There are things that you have to do. You have to ensure that your donor recruitment is top notch, from selecting the donors to all the tests involved to assessing the donor, not just the medical assessment, the physical assessment. You give a donor a questionnaire. There are several questions that the donors will answer that would eliminate or cause the donor to be accepted for blood donation. But a lot of times we do not even bother to have the assessment. We don't bother to first access the donors. Let them answer questions. That's why we need voluntary blood donors, because if you have paid donors, they may lie and tell you that, oh, this is the case, when that is not the case. But for voluntary blood donors, they are very unlikely to lie about their health status, their lifestyle habits. So the first step to having safe blood is to have voluntary blood donors. And now, one of the most important things that we should note is that medical laboratory scientists are at the forefront of, they should be at the forefront of this. They are not really at the forefront right now. But if more medical laboratory scientists, volunteer medical laboratory scientists like you, become more involved in raising awareness of voluntary blood donation. Sometimes the people that raise awareness of voluntary blood donation are even patients themselves that have probably needed blood at one point or the other, and they saw how hard it was to get safe blood. And they're the ones that now decide, okay, I'm going to do this. I'm probably going to get involved in doing blood drives or have an NGO or do this and that to raise awareness of voluntary blood donation. But I believe that medical laboratory scientists should become more involved. And so it's, when I was speaking with MLS Oluwatobi Adeleye, and she mentioned, I was like, oh, this is very interesting. I didn't even know there was something like this to start with. So it's very important that more medical laboratory scientists become involved in raising awareness on voluntary blood donation. Now, when you've had the blood, you've raised awareness, you've screened your donors, you've assessed your donors prior to donation. If you do all this and then when you get to the laboratory, the blood is not screened properly, it defeats the entire purpose. So the blood that is collected from voluntary blood donors should be screened properly. And we should really get to the point where we no longer do shoddy practices in our laboratories, from just using rapid test strips to test for transfusion transmissible infections. So our blood screening should be the best there is. We shouldn't rely on rapid test kits. We should rely on more sophisticated tests testing methods to test the blood that is donated in our hospitals or in our laboratories. Another way to improve or to increase the availability of safe blood in Africa is the rational use of blood and blood products. Now, you know that for excess for a patient that needs blood, it can get to a point where the patient has circulatory overload. But if the blood, the patient's blood need is being rationally met, then the risk of having circulatory overload or other things or other complications of repeated transfusions will be reduced. I know that a lot of times people are very reluctant to put the um, indication for transfusion, but if the indication for transfusion is put on the patient's forms, then we know, okay, this is the reason why this is the best blood product to be used uh for this particular problem. We shouldn't just say, oh, whole blood every single time a patient needs blood. There are other blood products. We should actually be more driven towards using blood, and it even increases amount of blood available in our blood system, because by the time you use by the time one single unit of blood is used for several patients at a time, it means that we have more in our supply, as opposed to using whole blood every single time a patient needs whole blood, regardless of whether it's work for the patient or not, or whether it will cause circulatory overload or not, or other problems associated with repeated transfusions. All these things would also not work if we do not have a stepwise implementation of effective qualitative systems. We should always, as medical laboratory science, we should always preach quality. Quality should be our watchword. Right from, we should always implement quality management systems in our work, good manufacturing practices. We shouldn't just be comfortable with the status quo. We shouldn't be okay with, oh, this is how we used to do it 20 years ago. Even if there are newer methods, we are, oh, this is what we did 20 years ago. We don't want to change. We don't want to improve. We are comfortable with being stuck in the status quo. We should constantly review our methods. We should constantly be committed to implementing quality systems in our laboratories. Quality systems should not be compromised on at all. We shouldn't really compromise on quality at any point in time. You can't have, and this even brings something else to my mind, because when you think about it, we do not have 100 a stable power supply, and then we're talking about blood business. We're talking about having safe blood. And if we do not have steady power supply, you need to store your blood in constant power supply, in 24 hours power supply. There should be no point where you are not having electricity to power your blood banks, your agitators, your freezers for plasma. And yet we don't have 24/7 power supply. So all these things really matter a lot. We shouldn't compromise on quality. We should not say, oh, one time we are managing the electricity and then our blood banks are off. We should not compromise on quality at any point in time. If you can look at producing safe blood the same way you look at producing commercial products, say the common thing that you use, say your hair cream, your beauty products, the food that you eat. If you can look at ensuring you adhere to quality once it comes to blood, the same way you expect your industries and manufacturers to adhere to quality when it comes to manufacturing the food that you eat, then it will be a lot better. There should be periodic training of staff. The medical laboratory scientists should be constantly trained. There should be constant training. You shouldn't just say, oh, this is the first thing, and then the next time there'll be a training will probably be 5 years later. There should be constant training of staff, because sometimes you need to learn, you need to unlearn the things that you previously knew, and you need to relearn new things. So you have to constantly undergo trainings. Then you have periodic assessments. Sometimes the systems you have in place may work, and then you may need to put some improvement in. So you need to have periodic assessments of your work processes in the laboratory. Next slide, please. And if we do all this and then we don't have a vibrant national policy on blood, then there's a problem. As it is in Nigeria, we have a national blood transfusion service. But if you go across the states in Nigeria, the national blood transfusion service is not fully functional the way it should be. The national blood the national policy on blood should be the driver of safe blood in Nigeria. The same thing for Africa. The different countries in Africa should have a policy on blood that is the driver of safe blood, because there are a lot of things that medical laboratory scientists cannot do on their own. And then if we have policies in place, then all these things will be able to work better. Starting from having constant donor recruitment. So if we have there are countries really that have national policies on blood that work. So if we would look more at emulating the practices in those countries where things work better and implementing those in our policies, and still adapting the policies to suit our peculiarities, because even if there are countries where some things work, when we get down to Africa, it may not work the same way. So we have to pick what we need to pick, learn what we need to learn, and let's adapt those things that we have learned to suit our peculiarities as Africans and as Nigerians. A lot of this still boils down to the medical laboratory scientists, and that is you. If you learn all these things, you go through all the trainings, if you do every single thing, there's a policy in place, and the medical laboratory professional is not committed to implementing the policies, to recruiting blood donors, to doing all these things, screening the blood properly, we would be fighting a losing battle to have safe blood in Africa. So we need to be more proactive. Be more we need to be committed to ensuring that safe blood is available across our different countries. We need to be committed to ensuring that there's safe blood. If you need to have associations and groups where you organize drives in your localities, in your communities, these things are not as hard. And the amazing part is that there are lots of resources online. There are lots of resources for on how to recruit blood donors. There are lots of resources on how to approach blood donors. You can even, when you as a medical laboratory scientist is at the forefront of this, then you can now begin to recruit other people. Oh, this is something that is worth doing. Young people can be invited to join you, because if you look at it, young people, you are usually at the forefront of change. So we should be more committed to doing the things that would make us blood supply in Africa safe. Because if you think that I don't really need to do much, someday maybe you in the hospital that needs to save blood, someday maybe your family member, you need to be more proactive in ensuring that we have a safe blood supply. And right now, I have come to the end of this presentation. Thank you so much for listening. Thank you.
Thank you so much. Thank you so much, MLS Oluwatobi. So that was quite straightforward, and I really must commend you for proper time management. Like, it's really key, and then the message is clear and direct. So I think we already have a take-home message, which is, I that's what I really look forward to. Like, after every presentation, what is the take-home message? And it's quite clear: making blood safer for all. And as medical laboratory scientists, volunteer medical laboratory scientists to be precise, we need to play key roles in ensuring that there is adequate and safe blood supply for all, not just in Nigeria, but in Africa as a whole. So I don't know if there are questions. So people that joined online via the YouTube channel. So I don't know if there is any question. So I would leave room for like 5 minutes for us to like take questions. So if there are no questions online, I think I've got one or two questions for you. So
All
but
right.
let's check if there are people online that have questions to ask. So if you are joining us online and then you have any question, do it to type in your question in the chat box. So no question yet. So I really must apologize for taking much of your time. We delayed in starting, so I believe so much that time is of essence and you might have other engagements. So in the absence of questions online, I have one or two questions. So people are doing a great work in Action on Blood, if I got that right. Yeah, the name of the
Yeah, you did.
organization. Yes. Then that's a great presentation. So I was thinking, and it's so interesting to know that you are a hematologist. So we already know the problems, which is the good thing, yeah, about the whole stuff. Yeah. I believe so much that first step towards profiling a sustainable solution is just identifying the root cause, the problem. And one of the problems is just not having enough blood donors. And then the second issue is okay, where we have people who want to donate this blood, some of them may not be compatible with the recipients. And then this incompatibility might be as a result of blood group mismatch or that of infection and all that. So I was kind of thinking if there are other measures we can take, like research wise, are there other solutions? Since we have scarcity of blood donors, and then maybe blood products or other alternatives like um, some drugs that help in erythropoiesis and all that. So, are there other possible solutions that you are looking at, maybe as a scientist, as a hematologist, too? If there are other solutions you are thinking about apart from um, recruiting more donors or using other alternative products to ensure that the blood needs are met.
Okay, so in as much as there are alternatives to blood, there still would be cases where actual blood has to be transfused. And if we have a very large supply of blood, it means that we would have less chances of incompatible blood being what is available. So let's say we have 5 patients that need blood all over Nigeria, all together. Just let's use 5 as a representative number, and we have 200 people that are blood donors, and we have, say, this percentage as O positive people, this percentage as O negative people, this percentage as, so just let's have the different percentages of people with the different blood groups. Now you would believe that once the number increases to 1,000, remember that we had just 200 blood donors before, but if the number has increased to 1,000, it means that we have more people with those blood groups. So when we have more people that are donating blood, it means that we have more people with the blood groups that are necessary, that are needed, and then we'll have more blood that would be compatible. That's something that we always say in my organization. We always tell people when we go out is that you are somebody's type. Because people always ask, but my type is this thing, and I think I am O plus or O minus, as people would say. And then we
Mm,
always let them know that, or they think I'm AB minus or I'm AB plus. I'm like, you are actually somebody's type. There's someone out there
exactly,
that would need your blood. So you
exactly,
may think that it's not so common. Yes, it may not be so common, but there's someone out there that needs that blood type that you carry. So once we have more people donating blood, then there's a reduced chance of not having compatible blood. And then when we even have more testings done, then we can now even figure out those people that are resus null, that have the R null blood type. So we just really need to have more people donating blood, because there, in as much as we may have drugs that will induce erythropoiesis or would have all this, we also have alternatives to blood. Sometimes that will not work. We need actual blood, and we cannot manufacture blood. We cannot say, okay, let's add this chemical to this and add this chemical to that and then have blood. It's human beings that will donate the blood. So we need to work more on increasing our blood supply, increasing it. We've not reached anywhere as it is. We've not reached it. We've not even scratched the surface.
Yeah. So that's a brilliant answer. Like
So that's it.
yeah, in as much as we have alternative therapies, because currently I'm studying for my master's in stem cells and regenerative medicine. And in one of my assignments, actually my oral presentation, I presented on induced pluripotent stem cell for the generation of blood. So, and that was because I was looking at the angle of profiling solution to the blood issue in Nigeria, and not just in Nigeria, in so many countries. So, just like you said, it's difficult to recruit donors. In some cases, when you're able to get some donors, some of them may not really be the perfect match, or maybe due to, just like you said, um, somebody of a particular blood group has somebody that he can actually donate to, but the person not being a match might be because the person's blood is contaminated, maybe one of these um, transmissible infections and all that. So the person may not be a perfect match. So because of that, I was looking at, okay, why don't we generate blood in vitro, like grow blood in vitro that can actually be transfused and all that. And just like you said, there are so many alternatives, and the use of stem cell is one of those possible alternatives. But there might be ethical issues. So there might be ethical issues. Some persons may not want to like take blood that was produced in the lab. Yeah, so it still boils down to like intensifying awareness and then getting more donors on board, voluntary donors on board to meet the blood needs in Nigeria and other African countries. That's really nice. That's a great presentation. Thank you so much for your time.
I
I
also
can't
have to
hear
add that
you.
we have to work on our database. Our database. Because
Okay.
when you have blood donors, you have a database of donors.
Yes.
You have,
Yes.
and you can categorize them based on blood groups and several other factors. So if we improve, we don't just collecting the blood, that we don't maintain a database of donors. We should have that. We should have a
We really,
database of.
we really have a long way to go in Nigeria in terms of blood safety and then adequate blood supply. But just like you said, it begins with you, it begins with me. So you do your part, I do my part. So as medical laboratory scientists, we continue to create awareness and then go for blood drives and then make sure that we have enough blood to meet the blood demands of patients in Nigeria. So thank you so much, MLS Oluwatobi. That was a great
Thank you.
presentation. Thank you so much for your time. Nice having you. And we look forward to having you on board soon again. Yeah, enjoy your weekend. Yeah.
Thank you, and you too.
Yeah. Thank you everyone for joining. We've come to the end of this month's training weekend. Um, Next month we'll be having another session, and as time goes on we'll kind of inform you of the exact dates, exact weekend, the facilitator, and then the topic. Thanks for joining us. See you some other time.